Planet Vero Studio is powered by the Nolan Group of eXp Realty.
Welcome to Treasure Coast Community Health. We have 8 locations to serve you better. Our staff is dedicated to help you and your family. Here's your host, Vicki Soulé.
Good afternoon and welcome to Community Conversations. Today I'm here representing Treasure Coast Community Health as its CEO, but a lot of people still don't know what Treasure Coast Community Health really does. So I'm going to give you the 30-second summary. We do all kinds of primary care services, whether you have insurance, whether you don't, whether you're new to town, or whether you're an established member, whether you want high quality or exceptionally high quality, and we provide for the betterment of our community's health. And in order for us to do that, it takes a whole village, as they say, to raise a child. It takes a whole community to help its citizens. And so my guests each week are usually from the community, sometimes from our internal resources, but oftentimes part of an individual or organization that collaborates with Treasure Coast Community Health to make our service delivery even smoother, more efficient, and therefore better for the community members. So today I'm thrilled to have someone I've known for a very long time, Bob McPartlan, who is the representative for the Florida Department of Children and Families. And many of you know Bob also in his role in Sebastian as, what is that elected official called again?
A council member.
A council member. So he is your go-to guy, one of several, for those of you that live in the northern tier of Indian River County. So welcome, Bob.
Oh, thanks for having me, Vicki. And then before we get started, I just want to give a plug then, I guess, also for Treasure Coast Community Health. They're a fantastic organization, and I have personally used them for my own dental treatment as well as utilize their mental health services for my children. And they're a great resource. And
thank you. A lot of people assume that public health organizations only deal with poor and uninsured, and they give substandard care because that's all they can afford as their providers. So it's wonderful to have your testimonial. You can go anywhere you want. You have great insurance.
Absolutely. Absolutely.
So thank you very much.
You're welcome.
And I didn't have to pay for that either. So at least not in cash, right?
Right.
No, I'm only kidding. So Bob, tell us a little bit about the Department of Children and Families, because most of us, when we hear DCF, until we're better educated, revert back to some of the negative aspects of what your organization, your agency has to do.
Well, that's what we're primarily known for, is child abuse investigations and having to remove children from the home. But we're a much larger organization than that. Of course, we do child abuse investigations. We also do adult abuse investigations, because that's another extremely vulnerable population that we have. And then we kind of oversee the Medicaid food stamps portion for the federal government. Like recently after Hurricane Ian, a couple of the counties were designated as disaster areas. Last week, in fact, I was over in Port Charlotte running one of the disaster recovery centers and trying to help people get back on their feet and back to some sort of normalcy.
So that's a great organizational initiative. Because you can mobilize, you know what needs to be done, and as an official, that's where you go and what you do. And I have to give a plug for DCF as well, because we've had family members that have been investigated, and of course they're highly offended, up in arms, very defensive. But from a grandparent's perspective, I have to say, if my child and grandchildren were living out of state, I'd want to know that there is a group that is experienced in this, that can be objective, and that can swoop in, and if my grandchild were at risk, help them get out of a bad situation. So thank you for that.
Right. Well, that's the department. We investigate abuse, neglect, and threat and harm. We don't go in and decide, like get involved in custody issues between parents about this parent is better or that parent is better. And typically 70% of our cases involve domestic violence or substance abuse by parents. And again, you could have parents that are utilizing drugs. Some people think it doesn't cause anything, but depending on the age of the children, how are they adequately supervising their children, or, the conditions of the home? We also get that environmental hazards. Some people, they live a lot differently than you or I. And, a lot of times some of the really bad conditions I've seen in a home, that's because there were underlying conditions also of the caretakers, be it mental health or substance abuse issues, and we try and treat the whole problem. Of course, if it rises to the level where those children cannot safely be in the home, or we can't put any services or have any family members monitoring the situation, we do have to remove children from the home. And it's only in about 7%, actually 5% of the cases we receive where children have to be removed from the home. Also, the state, believe it or not, receives over 300,000 child abuse reports each and every year.
Wow.
Yes. In our 4-county area, which is, of course, I'm the Community Development Administrator for Department of Children and Family for Indian River, St. Lucie, Martin, and Okeechobee counties. Our 4-county area gets about 6,000 child abuse reports each and every year. St. Lucie's about half. Martin and Indian River, roughly about 20% of the cases, and then Okeechobee is just under 10% of the cases.
So you all do the actual investigation and then make recommendations, and that small number of children, the 5%, that do need to be removed, are you a part of that in terms of placing them in temporary foster care?
Right. But again, when we determine that children have to removed from the home
for their safety,
we look to relatives or non-relatives, a friend who know the family, because we would rather take children from their parents and place them with somebody they know, also who's involved in their community. So a lot of times they wouldn't have to change a school, but we have to do background checks on all those people, and that means their Florida criminal checks, their national criminal checks, and make sure they had no prior history with our department, because we don't want to take children from a bad situation and put them in an even worse situation. Right. And typically, and we have focused primarily on doing that because we don't want to place children in foster care if we can help it. And we have been successful in about 2/3 of the cases, 67% of the time, we place with a relative or a non-relative who knows the family.
That's such a better alternative than the way things used to be.
Right. Because I believe that children, they belong with their parents if they safely can be with their parents. But then there are times, in about 1/3 of the cases where we do have to place children in foster care. And so while I'm here, I like to plug, we have the need for more foster parents in our community. Because sometimes the worst thing, and I have removed children from their homes where there was a large sibling group and there wasn't a relative or anybody. There wasn't even a foster home who could take, like, say, a sibling group of 3 or 4. Wow. And here you have these children who have been through abuse or neglect, and they've been together. Now you have to separate them from each other. And sometimes it's several counties away. So we always have the need for foster parents. Again, it's an ongoing kind of thing because sometimes the children we do remove, we typically give parents a year to establish what's called permanency. Right. And if they cannot have the children returned to them, then the court, and if they cannot be placed permanently with the guardian they're with, we do look to terminate parental rights. That will make a child free and open so they could be adopted, because every child deserves permanency in their life, a forever home that they can be in. And so a lot of our foster parents, in some cases, they wind up becoming the adoptive parents. And then, it's like they have no more room in the inn. Right. And so they can no longer, foster. So we have the ongoing need for foster parents.
And so tell us a little bit about the kinds of folks or the limitations, as it were, if you were considering being a foster parent. For example, if you are working, both parties are working full time. Does it have to be a typical family, or can single individuals foster? What kinds of things would be restrictive, and how would they go about applying to be a foster parent?
Great question. I'm like a full service advertisement here, is because a lot of people think they need to have everything to be a foster parent. Number one thing you need is just caring for children. You know, you want to care for children. You want to see their best interest. That's
enjoying
the most
children,
important thing.
patience, kindness, those kinds of attributes.
Exactly.
Okay.
So, you know, you can own a home. You could rent an apartment. You could rent a home.
Okay.
You know, as long as you don't have a criminal history involving violence or substances, but that could be from years ago, and you're open to taking children into your home. They have classes, our community-based care agency, which is Communities Connected for Kids. We have several licensing agencies who license prospective foster parents.
So they don't have to have experience as a parent themselves. It could be a younger couple or individual.
Correct.
Okay.
Correct. And we have classes. I think they run usually 6 to 8 weeks, depending on how many days a week you go or how many hours. They'll do background checks on you. You will be fingerprinted. They'll check the other states you may have lived in to see if you had any abuse history there. They will look at your home to make sure that it is safe for children. And again, one of the largest populations we do have a need for is teenagers. Everybody wants a brand new baby.
Yes.
That, you know, but we are in need of homes for teenagers.
So with that thought, we're going to take a short break so you can think about, in our listening audience, whether you are interested or know of someone who might be interested, because it doesn't always have to be a long-term engagement, correct?
Correct.
Okay, so we'll be back after a word from our sponsors, and we'll have more interesting questions and discussions. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
You bathe in it. Your kids drink it. You even wash your family's strawberries in it. Your water needs to be pure. Let Affordable Water give you a free quote to make sure you're getting the best water possible.
Affordable water.
You can trust Sandpiper Pest Control, serving Indian River, St. Lucie, and Brevard. Certified by the state of Florida to treat homes, lawns, and termites. Fully licensed and insured. Priced right, effective, and friendly.
Hi, this is Joel, the owner of Sandpiper Pest Control. Sandpiper can solve your pest issues. No contracts to sign, just results.
Call for a free estimate. 772-589-0204. Sandpiper Pest Control. A member of the iTex trading community. Your iTex dollars are welcome.
Even with all this financial uncertainty, real estate is still the best tool to build wealth. Whether you're looking at investments or using your real estate to provide a legacy, let us show you the way. I'm Chris Nolan of the Nolan Group of eXp Realty. Visit mynexthomefinder.com.
Other lawnmower places may be struggling, but More Motors has an unfair share of inventory. An extra truckload of mowers just came in, so take advantage now. More Motors has more lawnmowers than you've got blades of grass. As a Cub Cadet dealer, More Motors has zero-turn riding mowers and walk-behind mowers galore. Their unfair share of inventory is going fast. More Motors, your Cub Cadet dealer. 5135 US 1 Vero Beach. Anything and everything it takes to make tall grass short. More Motors.
And welcome back to Community Conversations. If you're just joining us, maybe you just tuned the dial over, maybe you just jumped in the car and started the radio going, or maybe you were just lucky and have listened to us every week. Just kidding. My name is Vicki Soule. I am the CEO of Treasure Coast Community Health, where we're happy to provide affordable, accessible, comprehensive health care to our entire community, regardless of their socioeconomic circumstances. And I do want to give a shout out to all the people that came to our annual fundraiser, the Great Duck Derby, this past weekend. It was wonderful to see you all. We had a great time. And especially we thank all of you that bought adopted $5 ducks to be in our Great Duck Derby race. because those funds help those that are not fortunate and would otherwise be reluctant to get care at all. So thank you again for being there. I have today, if you are just joining us, Bob McPartlan from the Florida Department of Children and Families. And we've been talking about some of the roles and responsibilities of that agency and how they pertain to our community. Bob says that he's covering 4 different counties, Martin, St. Lucie, Indian River, and Okeechobee. But the agency itself has a lot of different responsibilities in each of those counties. And just to give a quick recap, we all know that they are the investigative team for child abuse cases, for geriatric cases, and go ahead with the rest of the list because my memory is short.
Well, I would say, a big one is we do adult abuse investigations, and that's another vulnerable population. And it seems the largest maltreatments involving them are, one, exploitation of the elderly done by others, as well as self-neglect. A lot happens. You could have adults that are married, say, for 50 years, and one of the spouses passes and the other one goes into extreme self-neglect, as well as also exploitation. Like I had mentioned earlier about Hurricane Ian, there's always a lot of people that are out as predators. I mean, you see the same people. You're leaving Walmart or the Publix parking lot, and you see the elderly person, walking their cart up to their vehicle. There's other people that are on the lookout for them that, hey, I can help you out. I'll put the packages in your car, get their phone number. Next thing you know, they're living in their house and using their, checkbook and stealing from them. And sometimes, unfortunately, a lot of elderly people, even though it might be a negative relationship with this person, it is a relationship and a contact that they have, similar almost to like a domestic violence relationship. Right. And then, those cases are a little bit different than when there's children involved, because an investigator could go there, and if they're what's known as oriented ×3, they know their name, they know what day it is and where they are. And if they say, look, I don't want your help, the state can't step in. But it's different when there's a child involved.
Well, and as we just talked about before the commercial break, we are looking for foster parents who, if the child needs to be removed for a short term or a longer term while the parents kind of get their act together, there's another loving adult that you can depend on, hopefully family or a close friend. But the adults in these situations don't have that as a resource. They're not assigned a foster parent. But there is a guardian ad litem program. And does the DCF referral work with that group as well? Right,
but the guardian ad litems, they're assigned for the children. So the easiest the way to remember, I guess you could say, is one is like when DCF, if we have to remove a child, we work with what's called dependency court.
Okay.
And you have criminal court, family court, traffic court. The easiest way to remember dependency court, it means the child was dependent on the state to step in because there was not another parent or appropriate caregiver to look over them.
Okay.
Now, in those cases, when we work in dependency court, we also, the judge, the department, we're always like, the parent's bad, bad, bad. The parent's attorney's always like, the parent's good, we don't even know why they're here.
Right.
That's where they have guardian ad litems. And that's supposedly the independent person who doesn't have, any kind of prejudice involved. And they look out for what's in the best interest for the child. And they can tell the judge in that case, look, the parents have worked may have not done everything on the case plan, but it's okay and safe for the children to go back to the home.
Okay.
Or they also assist where if a parent is, I call it stuck in the bubble gum, it's either their substance abuse or mental illness that they are stuck in and can't get out. They have to get out of it themselves. No matter what you do. The guardian ad litem is also tough in saying, look, the department has offered everything under the sun for this family to rectify the situation for the children coming into care. And
reminders.
They join on us for what's known as, termination of parental rights. And are like, look, this is in the best interest of the children. So the guardian ad litem, as well as we're always looking for mentors for youth, be it through the Boys and Girls Club, Big Brothers, Big Sisters. I know they're always looking on the adult aspect for like volunteers who could be like guardians for some elderly. I mean, it's in rare cases, where you have a person that lacks the mental capacity and there's no family or friends in the area.
But it does happen.
It does happen.
They come down as a couple, something happens to the spouse, and over time, the mental acuity, the conscious planning and day-to-day activities start to decline. And again, they need that support at times because they have no one else.
Right.
Yeah.
And like I always tell people, if they want to get involved in anything to help children, to help adults, because again, I'm also a Sebastian City Council member, so I get involved in a lot of other programs, especially Indian River County. I sit on the Children's Services Advisory Board. I'm on the Indian River County Executive Roundtable. I can't tell you, I forget how many other organizations I'm a part of, but my cell phone number is 772-708-2900 if anybody's interested in getting involved. I mean, this is our community. Like I like to tell people, this isn't DCF's children. This is the community's children. And I know, Vicki, you and your organization have been involved with a lot of our children as well. And it takes a village to raise children. And I appreciate the opportunity to be here.
Well, and as you say, they are our future, and we're responsible for them. And I think a lot of caring adults are just very concerned because they're already busy. They've made a commitment. They need to have some downtime themselves. And I think the fear is that they don't have enough time to give out of their already busy schedule. And yet, there are so many organizations that I think it's the continuity with the child, rather, it sounds like the old quality and quantity kind of debate in terms of raising children. But truly, if you have an interest in children and helping them, whether it's academically, socially, mentoring them, even an hour a week, I know a lot of organizations would like to hear from you. So tell us about the other types of things that you're finding about Indian River County that kind of places them uniquely. One of the things that I heard at the beginning of the program was many of the abuse investigations happen in St. Lucie County, whereas Indian River County and Martin County, not so much. But is it okay to report? I mean, again, in our neighborhoods, nobody wants to be that person that says, I think something funky's going on. Is there anything like anonymity to call in a concern, and who would they call to?
There's absolute anonymity. It used to be there were only certain people who were considered mandatory reporters, and that was law enforcement, social workers, teachers, nurses, doctors. But the state of Florida changed it years ago that everybody who sees any child abuse or neglect, they are a mandatory reporter. It's only the previously mentioned people who have to leave their name and number with the hotline. And the hotline's number is 1-800-96-ABUSE, ABUSE. And an investigator never reveals the report or information, who made the report. And again, people get a report on them, they always want to know, but we never reveal who the reporter was. So,
I think it's so important for us to stand up for those vulnerable that can't report or even indicate that there's a major problem going on in their lives.
Absolutely.
So thank you so much, Bob, for being here today. I know you do fantastic work, and I'm glad we were able to allow you to share a little bit more about how we work together as a community to protect those that are most vulnerable. So thank you.
Right. Thanks again for having me.
Okay. And thank you for listening in. I know it's probably not the most enlightening, exciting, feel-good conversation we've ever had, but I do think there's always something to be learned about our community that make it better every day. So thank you for your interest. And I hope that you're present again next week as we talk to someone else from the community. Take care now.